Okay, today we have 3 different speakers. You're going to hear from Shelley Hearn, who is president of CityHealth, Monica Liang-Aguirre, director of the Early Learning Division at the City of Seattle, and Gigi Weisenfeld, who is assistant research professor at NIEER, which is located at Rutgers University. Next slide. A word about CityHealth. So CityHealth is an initiative of the De Beaumont Foundation and Kaiser Permanente. We work to advance a package of evidence-based policy solutions that help millions of people live stronger, better lives in vibrant, prosperous communities. Pre-K is one of those policies. Next slide. And the National Institute for Early Education Research is at the Graduate School of Education at Rutgers University in New Brunswick, New Jersey. And it supports early childhood education policy and practice through independent, objective research. For the past 3 years, CityHealth, in a partnership with NIEER, has assessed access to high-quality pre-K programs and reported on the overall medal status for city pre-K programs. I'm now going to hand over this webinar to Gigi Weisenfeld at NIEER, who will talk about the report, which is available at cityhealth.org/reports.
Can everyone hear me?
Yep.
Great, thanks. This report is about assessing which cities are leading when it comes to pre-K program design and which have work to do. CityHealth awards gold, silver, or bronze medals to the nation's largest 40 cities in each 9 key areas, based on the quantity and quality of their policies and programs. The report analyzes city pre-K programs on these key measures, ranging from class size to access. CityHealth's assessment of pre-K quality is based on the NIEER, the National Institute for Early Education Research, 10 research-based quality standards, along with an assessment of the level of enrollment in the city's largest pre-K program. These benchmarks are consistent with what research suggests as minimums for highly effective programs. Next slide, please. I want to say a word or two about how our team arrived at our findings. Next. Let me go through we have 10 quality benchmarks. The first is learning goals. This describes comprehensive early learning and development standards to guide teaching and assessment. Curriculum support, guidance for choosing and using content-rich curriculum. The teacher education level, the minimum lead teachers are required to have a bachelor's degree, as well as teacher specialized training, meaning the lead teacher has specialized training for teaching pre-K specifically. Assistant teacher education. Assistant teacher has a formal entry-level credential, such as the Child Development Associate. Professional development refers to ongoing training for teachers and assistant teachers. The maximum class size is 20, and the teacher-child ratio is a ratio of teachers to children is 1 to 10 or lower. The health screening and referral benchmark refers to screenings for vision, hearing, health, and development concerns, along with referrals to needed services. And finally, the continuous quality improvement system, systems to assess program quality used to guide improvement. All of our data are based on assessments as of December 31st, 2017, and this is for the 2015-16 school year. Next slide, please. Thanks. We have included some additional data that are not included in the 10 benchmarks that do advise the medal assignments, and we thought it was important for city leaders to know about. The first is whether pre-K teachers earn salaries that are comparable to K-12 teachers. Next, whether the city is improving program quality and expanding access by raising local funds dedicated to pre-K. And finally, whether local funding is assigned to improve quality or access. Now I'll pass on the mic to Shelley Hearn at CityHealth, who will review the findings.
Thanks, Gigi, and it's been wonderful working with you and the entire NIEER team just consummate professionals and really your eye on what's happening out there on pre-K across the country. So let me give a snapshot here of what our collective group found. And really the good news is that most of the large U.S. cities that we studied have a pre-K program in place, but it's clear that a lot more can be done to maximize outcomes for children. So in order to fully reap the benefits of pre-K, we're urging city leaders to design high-quality programs that children and families can readily access. What we found is that while city pre-K programs are growing, some of those cities are missing key opportunities to get those lasting benefits for their youngest learners. So out of the 40 cities that we studied, only 13 of the largest ones met quality benchmarks for pre-K, and only 15 have low enrollment. On the next slide, Gigi had mentioned that the methodology for CityHealth is to give medals to help summarize really where programs are. The bronze medal in a pre-K policy analysis signals that a city has met the criteria for access, which means that they've enrolled at least 30% of their 4-year-olds. The silver represents a city program that mandates quality, meeting at least 8 of the 10 quality benchmarks that Gigi had discussed, but unfortunately they do not get gold because they do not have the, they have low accessibility. The gold benchmark means that a city has done both, that it's earned the top points for quality and for accessibility. Let's move to that next slide. So what we found overall for 2018 is that of those 40 largest cities, we awarded 5 cities with a gold, 8 with silver, and 20 with a bronze medal, based again on quality and access of each of the city's programs. There were 7 cities that did not fulfill enough requirements to even earn a medal. Let's move on next, so that everyone on the call here can see where, if you're in a major metropolitan area, you can see here the scores of those top 40. To review again, those bronze medals are just about cities that have met the criteria for access, which they have enrolled at least 30% of their 4-year-olds. Silver is about quality, getting 8 out of 10, and gold has hit both of those arenas of quality and accessibility. So let me move a little bit deeper into the data here and give you a sense of some of the overall trends that we saw with these cities, particularly since we have done the scores for the past 2 years. One of the key overarching trends that we saw is that access is still far too low. We've got challenges of access to pre-K programs being limited in most cities. Only 24 of those 40 largest cities offer a pre-K program that reaches at least 30% of 4-year-old population. And as a sidebar, while ideally we would like to see a universal access, we've had to start at a realistic benchmark, but it's something that we certainly encourage cities to be moving up in those percentage ranks. The other overarching trend we saw was class size, and teacher-student ratios are fairly uneven. We had just about half of the largest U.S. cities, just over half, 23 out of 40, or 58%, met those quality benchmarks for pre-K class size, which is, again, as Gigi had noted, it's 1 teacher and 1 teacher assistant for every 20 students, a 1-to-10 ratio. Again, another overarching trend that we saw is that while teacher preparation is generally solid, but there are challenges out there on the professional development, and salary requirements are significantly lacking. We had almost 2/3 of the city programs that are requiring their pre-K teachers to have a bachelor's degree, with that specialized training and teaching for young children. And most of the programs, about 80%, required at least some specialized training. That's great news. It was only a fraction of the city programs, 15%, that require all teaching staff to receive ongoing professional development. And only 15 of the rated city programs require that all teachers be paid comparably to those in the K through 12 system. The last overarching trend I want to share with you is this issue in terms of the opportunity to identify health problems that a child may be facing, to catch that very early in their lifetime, which can really help set them up. If you address and fix health challenges early, you tee them up for an extraordinary opportunity to be learning better, to be healthier and more vibrant. Unfortunately, too few cities actually ensure that children are receiving medical screenings in those pre-K environments. We found that fewer than a quarter of the cities, 9 out of 40, ensure that children receive vision, hearing, health, and developmental screenings and referrals. Go to the next slide now. So the last point I want to make in terms of some of the issues that we've seen, and some of the greatest challenges we know are out there about raising funds for pre-K. The interesting news, and it's important opportunities to be learning from each other, is that 20 cities raised new local funding to advance their pre-K programs. And 7 of those funding streams were designed to achieve higher quality. 8 of those funding streams were aimed to improve enrollment rates. And 5 of them are combining both and really pushing to get both those quality and enrollment numbers up. What I'd love to do is to introduce Monica to you now and let her tell you about some of the realities and some of the successes that they've had in expanding access to high quality pre-K in Seattle. So Monica, let me turn the helm over to you, and thank you for being on here and sharing your insights.
Great, thank you. Hi everybody, my name is Monica. I'm the Director of Early Learning for the Seattle Department of Education and Early Learning. Been in my role for almost 4 years, just as our Seattle preschool program was literally launching is when I started. You know, I want to also thank CityHealth and NIEER for this report, because honestly, as we make the case for public education, reports like this are incredibly useful. I can't tell you the timing of this, the release of this report, and us coming out with a silver medal, and you know, our only growth area really being, according to the report, being our access, really gave us great ammunition and evidence for why we need to continue this investment in Seattle. So thank you for this work. It's also really clear that it's so complex to do this right, and there's no easy solution. So I'm here actually to talk about how we have worked with our Seattle community to fund preschool here in Seattle. And it's actually a really unique story, and it goes back almost 30 years. So if you can go to the next slide, please. Seattle has almost 30 years of families and education levies. So back in 1990 was the first levy that was passed with voter approval for a $69 million 7-year levy that was really dedicated to enhancing the public school system and working to ensure that all Seattle children are safe, healthy, and ready to learn. That was sort of the motto of the first one. And this was done by Mayor Norman Rice, who gathered an education summit of activists, of community leaders, of politicians, elected officials, faith-based community to come together and really talk about how we can support children in Seattle. And that was how the first levy was created. And then you'll see that every 7 years after that, it was renewed by voters, and it grew steadily. So, you know, by 2011, it was a 7-year levy that had more than tripled the original value of the 1990 levy. And while it first started in about K-12 and all of the investments in the school district, it continued, and in 2004, it actually introduced preschool as a strategy, and that was new. That was a new strategy to reduce opportunity gaps for the city, and it was really designed. It was a means-based preschool program. It still exists. And was the start of a real strong focus in Seattle on early learning. And that continued in 2011 as part of this Families and Education Levy. So next slide. But then in 2014, something beyond the Families and Education Levy actually took place. Our elected officials committed to looking at early learning as a stronger investment, more than what was in the previous levies. And even though the other levies were still active, our city council in 2013 started hearing testimony about the importance of quality preschool and how the impact that it has long-term on children's lives. And they heard about all these positive effects, that they actually unanimously passed a Preschool for All resolution, which basically then, basically endorsed the creation of voluntary high-quality preschool program for all 3- and 4-year-olds in Seattle. And the resolution directed the Seattle Office for Education, which is now our office, to develop an action plan for making this high-quality, affordable preschool available to all kids. So, so you can see it was really first the city council learned about it and became passionate and became the greatest endorsers of really investing in this, and actually went to pass a resolution to put this work forward. The city then worked with different consultants to come up with a plan for what this might look like. We worked with Burke Consulting and also Dr. Barnett and Dr. Ellen Freedy from NIEER, and we all worked together to create this recommendations for Seattle's Preschool for All action plan. And that was submitted to the city in 2014. A lot of community outreach was done. In Seattle is very unique in the sense that there's a lot of process that goes on and everything in Seattle, which makes it very unique. Sometimes makes things move a little slower, but the benefit is that it really gets everybody's input and perspective, and we don't let we make sure to include all of our stakeholders in every step of the way. And I'll talk a little bit more about that in a few slides. But there was an incredible community outreach done to really solicit input from everybody on different topics, including data management, finance, health, the infrastructure of the program, what the program quality capacity looked like, and workforce development. And so this in the end became the mayor's action plan, and it became ordinance. And then in 2015, in 2014, it was voted. Over 65% of the voters supported this extra levy that was focusing just on preschool, and this is the Seattle preschool program that was referred to in the pre-K study. So you can go to the next slide. So I think if I were to give you one takeaway, and I probably should have written this on the slide, is that it's really, really, really critical if you want to solicit local funds. It's really critical to activate, to have just the robust communication with community, and to do that in their space, and so that you can build a strong coalition and really informed voters before you even ask voters to support such an initiative. So some of the strategies that were used are, citywide education summits. So we had the summit back in 1990, and then I'm not sure if there were any other in between, but just before this last levy that we just passed last November, we did another series of education summits. We have to have strong political support, so find your allies, elected officials who are the champions of this cause. We did a study mission that was funded by the Chamber of Commerce that was specifically for a Seattle preschool program, where we visited Boston and DC and New Jersey to really get a sense of what what it takes and what it looks like on the ground. And that was really, really inspiring to all of our officials. And it was a huge undertaking to get elected officials and community folks and practitioners to go and do this visit. But I think that was really critical, and people still refer to that as they push us to make improvements. And then just broad information sharing on the benefits of our investment. So in education broadly for our levies, but also for preschool. So I think Seattleites are very informed about the need for high quality education services and then the impact that preschool can do because of this very robust information sharing approach that we've taken in community. And then finally, a lot of stakeholder engagement and getting input. So here in Seattle, you know, we have to ensure that our communities have input in our strategies and our approaches, in the program development and how we assess. And we hold many different meetings across the city that are topic focused, and that we're soliciting input directly on issues that will impact our implementation plan. So a lot of work ahead of time and a lot of work in the planning process, but I think that's really been key in continuously having the support in the city of Seattle. You can turn. So we are actually, so that was the Seattle Preschool Program that was a 4-year levy in 2014. And so all these levies, so the Families and Education levies and the Seattle Preschool levies all expired in 2018. And we just recently went out again to voters in November of 2018 for a new levy. This is a really big levy because our new mayor not only was interested in continuing the preschool and all of our kindergarten through 12 investments, but she also has a new program priority on post-secondary. So as our department has grown over the course of the last few years, and we really are now a department that goes from preschool to post-secondary, and our current levy includes all of this whole continuum, and preschool is a big part of it. Go ahead. So again, when we were preparing for this levy, just to get renewal, this is an example of the different meetings that we had across the city, and as we were preparing the levy and what is going to be contained in it, this is what we heard from communities. We heard about closing opportunity gaps. We heard about early learning, expanded learning opportunities, system coordination, and wraparound services. Those were the priorities that community gave us, which we then in turn were able to incorporate into our plans and into the ordinance that voters finally weighed in on last November. So go ahead. So you'll see that the current levy that we have is a 7-year levy. It is almost $640 million, and it includes everything from preschool, which is the majority of the levy, 54%. Our K-12 investments, health investments, and the Seattle Promise, which is 2 years of college tuition for Seattle high school graduates. So that's sort of where we are right now, and we're in a place where we're just getting the implementation plan is just went to council this week, and council needs to vote on it and weigh in, and they make their adjustments as they see fit. But we feel really confident because it's a plan that is going to council that really reflects the best thinking of our department, of all of our partners, and of community, and all of our stakeholders and practitioners, and the families that are actually going to be impacted most by these programs. All have had a chance to weigh in and to give their opinions and their suggestions. And so we feel confident that this plan is reflective of the Seattle priorities, and you know, are keeping our fingers crossed that everything goes smoothly in the next few weeks as council deliberates and hopefully moves to approve it in April, so we can actually start implementing our funds. And so that's how we're going to be continuing the next 7 years of the Seattle Preschool Program as part of this levy. So my last slide is just I get a lot of questions about, well, what does it actually look like? What is, this levy? So this is just from from some promotional material that our council member's office put out of what a levy actually means to taxpayers. So they were explaining that the current levies right now are approximately $136 per year for the median house, and going up to $248 per year with a new levy. So it's not a small investment, and our taxpayers continue to rally behind the education priorities that our city sets forth, and so we're very fortunate to have so much support. But I would say that the most important thing is I think that we have going for us, in addition to significant affluence in Seattle. I don't want to minimize that at all. Is that there's a strong understanding of the value behind education, and especially preschool. And so we have always been very fortunate to have that support, and we are able to use that to our benefit. So that's a quick snapshot of the local landscape of funding here in Seattle. And there's my contact information. Feel free to reach out if you want to follow up and have any questions.
So next slide. We at CityHealth, this is Liz Boyles again from CityHealth. We have a new opportunity in 2019 for local leaders to engage with pre-K experts. If you're interested in learning more about how your city could get involved, please get in touch with Walker Irving. Her email is on the screen. The purpose of this new work is to connect experts with practitioners on the ground and talk about how some cities are able to create new funding streams for stronger early education programs. CityHealth is proud to announce this new work, which is done in partnership with NIEER and the Robert Wood Johnson Foundation. And so we encourage you to get in touch with us if you're interested in hearing more. Next slide. Just a reminder on how to ask a question. You can do that either through the speech bubble. You can open a chat box and use the raise your hand feature to notify us if you have an issue, and we'll send you a message. To type out your question, you type it into the chat box and press enter to send it. And you'll be able to select whether you want to talk just to the panelists or to all panelists and attendees so everyone can see your question. Please tell us your name and affiliation before you ask your question for the benefit of those answering it. I'll give everyone a couple seconds to type out their questions for us. All right, first question we've got is probably for Gigi and Shelley. Of the cities who have raised funds for pre-K locally, can you share some of the characteristics that they have in common? Gigi, do you want to take that one of what are the characteristics of the cities who are really leading on pre-K expansion and quality?
Sure. I think it's a little bit hard to generalize because they are all so unique. But as I look at the cities, I would say probably having strong leadership and political will, as we had just heard about Seattle, having people really believe in quality pre-K and wanting access to it. Other than that, all of the cities are quite different in how they've gone about raising funds, what they have deemed as their priorities for starting with quality. So it's kind of difficult to make a generalization, I would say. Shelley, do you have anything to add?
No, I think leadership is so critical, and sometimes it can come from the most unexpected places. It ranges from the elected officials who've made it a priority, but we've also increasingly seen the business community, chambers of commerce, who recognize the importance of having that investment in pre-K in setting up for a healthy city, vibrant workers, and a place that will draw in the best and brightest. So the champions can come from many different places. And in fact, Monica, I might throw this over to you. Were there some strange allies, or you did such great work in reaching out and having meetings and getting the word out? I'd be curious who were some of the maybe unexpected champions that came along in the process.
Sure. I mean, I think we definitely had a lot of champions for this, for sure. And we even had the local teachers union be in support of that. That was something that I was really pleased to see when I got here. And I think, for Seattle, hearing from the practitioners and the people who are most impacted by the programs that we are offering weighs so much. And so really elevating their voices and making sure that they are part of the conversation and giving testimony at council meetings, I think is really was a very positive thing for us.
Okay, great. We'll move on to our next question. This one's from Linda Warren. Were you able to get the level of support that you did in Seattle, Monica, by incorporating pre-K into the larger context of K-12 education and community initiatives?
So I think it always, the way that it rolled out here, it was preschool was a smaller portion of the original families and education levies. It was never elevated. It was never highlighted. And then when Seattle Preschool Program came out as its own levy, then that's when it really became a larger conversation. And that's when the heavy research really became prominent in our dialogue about the importance and about the impact that it has long-term on children, and what a smart strategy it is to invest in preschool so that we can eliminate a lot of the later challenges in preschool, in K-12 systems. So I think that was sort of the narrative of it. And so, it actually, whoever came up with this idea was really clever to have these two separate levies that then expired at the same time, so that then it could be rolled up into this new big mega levy, which we just passed, because there was so much momentum and so much public support behind preschool as its own type of investment that our voters just very, very strongly supported the preschool component of it. I think with every levy, there's certain areas that are more scrutinized than others. Our program in 2014 was so scrutinized. It was so heavily managed by everybody in our city. But we've been really lucky in our rollout and in our success that people have been much more hands off of it and just said, hey, this really works. This is a good investment, and have given us the green light to continue the work.
Okay, great. Our next question is from Allison Bentley. Has the expansion of pre-K in these cities influenced the sustainability of childcare, especially for infants and toddlers? These child centers often rely on funding from 3 to 5-year-old children to have a sustainable funding model. Thank you.
This is Gigi, and I can comment that unfortunately, even with if we took all of our child care dollars, we still would not serve all children. So even having increased funding at the pre-K level, there's still not enough funding to go around. So there might be some shifts in certain cities with some programs, but it's typically, there's still not enough funds to really meet the needs of all children. Also, childcare programs tend to be longer day programs, where pre-K programs tend to be more of a school day type program. So sometimes different family needs can also dictate where children may enroll in programs.
Yeah, and I would add that we certainly have experienced lots of sort of unintended consequences through our focus on preschool, right? And I think one of our biggest learnings was preschool cannot exist in a bubble, right? It impacts everything. It impacts childcare. It impacts our birth to three providers. And so we are being very purposeful in the next iteration of our programming to really think of it as a continuum, and to look at other investments that we have in early learning, and make sure that we're working in alignment with everything, so that we're not robbing Peter to pay Paul, and that we're not inadvertently hurting certain types of providers. And childcare is absolutely a critical piece of preschool, because we are purport a full day model, but full day is 6 hours, and that's nobody's work schedule. So we need to really make sure that in this next levy, we're committed to thinking through an extended day model as well, so that or rather extended childcare to be built into our preschool funding model.
And also, this is Gigi, I just want to add one more thing, that a lot of cities have been effective also in blending funds, using childcare dollars to perhaps offer different hours or extended hours, and then the pre-K dollars to cover possibly the school day hours. So there's been different models that different cities have used.
Yeah, we do that, right.
Okay, great. Our next question is from Leanne French. Louisville, Kentucky is currently at silver and is committed to reaching gold. Our local Ready for Kindergarten Alliance collective impact work is leaning into improving quality in early childhood centers. Is increasing access or enrollment the next key step for our work?
Gigi, this is Shelley. Maybe you and I can tag team on this. I just want to note, Louisville, Kentucky, as when CityHealth came in and has scored it each year, is a city that really popped up on our radar screen for its leadership and committing to create the healthiest environment possible for its residents, anyone who works, lives, plays in that city. We saw it go from a city that had no medal in its overarching score, and through leadership in many different policies and areas, it's moved up into bronze, and we see a continued commitment in all aspects. So, Leanne, it's great to hear that kind of commitment spills over into moving the city's medal from silver to gold for pre-K, because obviously we all know how important that is as a policy. Yes, the answer is it is about access, and in getting past that 30% number enrollment and getting that as high as possible is what will move Louisville, assuming it continues to keep meeting 8 out of 10 or more of the quality benchmarks. It is now about creating greater access to its programs. So please keep up the good work and let us know how we can be helpful.
Yeah, and thanks, Shelley. I would like to just add that often we get asked that question, which is more important, access or quality? And we say both, because you really do need both. If you have a great high quality program, but only a small percentage of children can attend, then only that small percentage of children are benefiting from this fabulous program. However, on the flip side, if you have a lot of children attending, but it's low quality, you're not going to see the outcomes that we know research has shown us will be achieved. So it's important to really balance it. And New York City is an amazing example of being able to increase access as well as keep the quality at a high level. So it's doable even in large cities, but it takes a lot of work. So we're happy when cities are asking us about those kinds of questions.
Gigi, thank you for that point. This is Shelley again. I just want to add, it's that kind of getting the right balance, keeping the commitment there. These are the kinds of issues, conversations, and very practical, rolling up the sleeves, figuring out how to help individual cities, looking at best practices going on with peer cities, mentor cities, looking at all the different kinds of opportunities and options that have been working around the country. That leadership network that we're creating with the support of Robert Wood Johnson Foundation's investments is the, again, I want to open up the door and encourage anyone who is interested in having their city be involved and engaged. This is where we can share those best practices and help tailor what could work in each city, because everyone is unique. There are different settings, but we're all committed to getting both access and quality up to its highest possible standards.
Okay, great. The next question is from Linda Warren. For Seattle, do you see any enrollment changes or trends in elementary and the upper grades due to the availability of universal access to preschool?
I'm not exactly sure I understand enrollment changes or trends in elementary school. So, sorry, can you clarify what you mean by that?
That's all we have, Monica, sorry.
Okay, sorry, that's right, I'm not speaking to anybody. So I think, you know, what I can say is that we don't have that much long-term data yet on our preschool program. In terms of trends in enrollment, I don't think we have anything that I can point to that's concrete now. What I do know is that our preschool enrollment is different from our public school enrollment in the sense that it tends to be, it's majority children of color, and it is more families that are from low income backgrounds and receive free tuition, and that's not what the Seattle public school system looks like, at least not the kindergarten entering class. So, but we don't have enough data long term to really see if this is going to have a change and whether or not more children will enroll in Seattle public schools as a result of the preschool programming. We hope so, because Seattle Public Schools is offering about 30% of our programs are in the school district. So, you know, there's a lot of momentum for families to stay in their schools. Hope I answered your question.
Okay, great. We'll just wait a couple more seconds to see if there are any other questions. We have one more. Mark Holloway. Does CityHealth have an assessment of what it takes to provide access in terms of family affordability, providing 100% of the cost of pre-K for every family, for those under a certain poverty line, or portions of funding based on financial need? How do you assess cities at gold level on access? Gigi, do you want to take this one?
Sure, this would be a long conversation, but why don't I start with the first part on how we assess cities. So we looked at a 30% threshold, as Shelley mentioned. So if cities were enrolling at least 30% of eligible of all 4-year-olds. We did not look at any eligibility criteria, but just a straight number of 30%. We know it's not ideal and there should be more children, but the reason that we came up with that 30% number was that is nationally what we found is how many children are enrolled or have access to a state-funded pre-K program. So we used that same number. In terms of how the access question gets tricky, because some cities start and target certain populations, such as low income or children in certain communities. Sometimes people will just go for straight access. Some cities have a kind of a co-payment where certain families will pay, like in Denver, for example, where there might be kind of a subsidy that helps support the program for families that make over an income threshold. So it really depends. In terms of how much it would cost to enroll all children, we can go back to kind of that earlier call. Not everybody wants to enroll in a city-funded program. So usually we estimate probably about 85% of the 4-year-old population would be a good estimate, assuming that some parents or families might choose not to enroll. Some families might enroll in a different program that's not a state-funded program. Some families might enroll in a Head Start program. So there are different needs that a family might have. So thinking about kind of what all of those factors are, what is the number that a city needs to meet that unmet need of families looking for programs? I think I'll probably just stop at that point and then let Shelley, if you'd like to respond at all, or Monica.
No, Gigi, this is Shelley. I don't have anything to add to the methodology you used nor the challenges that you identified.
Yeah, it's a very complicated process, and I was hoping your answer would be yes, of course we have the perfect model, because we'd love to hear it. But no, I don't know.
Okay, well, that was our last question. But you can see on this final slide that you have all the contact information for myself and for my colleague, Michelle Roos, who is at NIEER. If anyone has any questions for Monica in Seattle, we will absolutely pass them on to her and put you in touch. We encourage you to follow us on Twitter and Facebook, and just get into contact if you have any questions or want any updates about our work. Thank you so much for being on this webinar today, and we hope you all keep in touch. Have a great day. Bye-bye.
Bye.